cavity. And in the oral cavity, mechanical digestion happens because of your teeth, and that's called mastication. Chemical digestion is for carbohydrates only because of salivary amylase. So then that food, when it used to have just intact polysaccharides, polypeptides, and lipids, after it has been acted on by amylase in the mouth, you will now have some glucose molecules. By the way, are you familiar with the term polymer and monomer? Yes. Polymer is your polysaccharides, right? And the individual units will be this is the substrate, and then the product is what you call monomer. You can also have dimers, that can also be a product, right, from the polymer. And the enzymes will break the substrate to come up with these two products, okay? So you can have disaccharides also. After digestion or mixing of the saliva with the food, plus untouched lipids and polypeptides. And we said this is what we're going to swallow, and you should know the openings that need to be closed. The point is this should go down the pharynx and then down further towards the esophagus, and finally landing in the stomach. What the stomach receives is what you call bolus. So bolus is the food that has been acted on by saliva, which contains all those contents you should know. And bolus is alkaline in pH. Always think about what it contains as far as the products are concerned. So from there, now we're going to go to the stomach. I think we're going to go all the way to pooping today. We can poop, okay?
Oh, that's good. We've been holding it for a long time.
I know it. So now the food goes down to the stomach. Remember that the pharynx and esophagus are nothing but muscle. We just say muscular passageway. So there's no digestion, it's just movement. And the forward movement is called peristalsis. Okay? So there's continuous peristalsis, and because the bolus, you ever swallowed a spoon or whatever, you've seen some weird thing. I don't like peeling my shrimp, so I eat the whole thing. For me, it's a waste of time, so I just... So you're swallowing some... She's like...
You gotta cook it right, man.
Yeah,
Cook
yeah.
it
See
right.
the shell and
It's crispy
Yeah.
if you cook it right.
So that's why, does it make sense? Stratified squamous epithelium, right? To protect you. Then down here, it begins to become simple columnar epithelium. So from one area to the next, there's a boundary right here. There's a sphincter. This is called lower esophageal sphincter. And the lower esophageal sphincter will autonomically relax or open up. It's a parasympathetic reflex, right? It just opens up. What will open it up is the presence of food here. So the food will irritate this one, and the reflex will be relaxing of the sphincter, and that's how the bolus lands in the stomach. So now we're in the stomach, and the stomach is referred to as a mixing and holding chamber. I think I mentioned to DeAndre that the stomach is usually normally the size of a typical Italian sausage, so you buy a sausage, but it can stretch and expand, and we've seen some stomachs that have occupied the entire abdominal pelvic cavity, okay? So, now let's look at the anatomy so that we can appreciate the physiology. When you open up, or downstairs in the lab, what we did is we opened up the stomach, and you will notice that it's wrinkly. The wrinkles are called rugae. Rugae are temporary folds. You can stretch that. And that's what makes the stomach a very ideal holding chamber. Food stays here. The first food that can pass through is always carbohydrates, and then next is protein. And then next, the last one that stays there is actually your fats. They're lighter in weight, so they float up, right? So I think that's the secret of the buffet. They load it up with fat, so you feel full fast. Then when you get home, you're like, I'm still hungry. Here, ever happened to you? I can still eat when I go home. That's because it's just filled with fat. You fill this up right away. That's the secret. You don't get your money's worth. Okay, so then you have the rugae here. And looking at the epithelium, we see the cells. So the epithelium of the stomach is simple columnar epithelium. Now we see simple columnar epithelium. All of these. Some of the cells, you can see they're goblet cells. So what do? They make mucus. But there are other cells. Here, they're named for you, right here. Okay, I'm just going to go to the next slide. It's the same, it's just pictures in the next slide. So in addition to the goblet cells, some of them will be called mucus neck cell. They make mucus still, mucus, right? But here there's what you call the parietal cell. Again, we cannot determine which one is which under the microscope downstairs. You have to have special microscope. These are just aside questions, right? So some of the cells, some of the columnar cells here, their job is to make hydrochloric acid, an intrinsic factor. If that's what they do, their name is parietal cell. Okay? And by the way, that hydrochloric acid secretion is what makes your stomach acidic. The stomach is the only acidic organ in the GI tract. And I'm going to jump quickly to that hydrochloric acid right here. This is a parietal cell of your stomach. Just in case you're thinking that hydrochloric acid is made as acid, you're wrong, right? So there's the lumen of the stomach, and there's the interstitial fluid. CO2 is a waste product of metabolism of any cell. Combines with water to form carbonic acid. This carbonic acid separates. The hydrogen proton is the one that leaves and to enter the lumen, and then chloride is separate. It enters the lumen. When they're in the lumen, that's where they combine to form hydrochloric acid. It's very important for us to note that, because if the cells made hydrochloric acid, it's going to kill the cell, right? Because protein is the most abundant component of any cell. It's the most abundant organic compound. So this parietal cell, it makes the hydrochloric acid, but it's in hydrogen and chloride, and here in the lumen is when they become hydrochloric acid. That acid is what gives me confidence. When something falls down, what do? You pick it up and you give it to Baba. Because I know he has acid in his stomach, no problem. We don't even tell him. He knows it. When something drops and Lily says, Mom! He knows what happens. And I say, then Baba eats it all of a sudden. It's like, where did this come from? He knows already. Okay? The acid, what are enzymes? Protein, right? So enzymes can be denatured. Did you notice, look. Have you heard of insulin, right? Insulin? How is insulin given?
Injection.
Yes. There's no oral insulin. Did you notice?
Yeah.
There are some drugs that are given orally, some drugs no, they're only injectable. Now you can figure out, you're going to say, oh, I think that medicine must be protein-based because acid in the stomach just denatures that. Right? It's useless. It's a waste of money. You buy enzyme supplements, they sell that, right? Oh, use this enzyme supplement. It will help you lose weight. It's just right?
Mhm.
Because once it lands in the stomach, it's a waste of money. It's denatured. Your dogs, our dogs especially, we love our pets. Buy this enzyme supplement, buy this. Just look at the ingredient. If it's protein, do not buy it. You're just wasting your money. But I have asked this in the question. Asked in the question, in the test. Like, you know why insulin is not given orally? Now you know the answer. Anything that is protein-based, once it lands in the stomach, it will just be a waste of money. And this is why a lot of medicines, if they're in capsule form, or you notice it's very hard. That coating is meant to survive, maybe, so that you can push it. Meant to survive 4 hours in the stomach. Okay? Okay. So there's another important product of the parietal cell called intrinsic factor. Can you please highlight intrinsic factor? So people who have stomach cancer or any stomach pathology or like resection, there's some surgeries where they take out portions of the stomach. One very common consequence of that is anemia. Intrinsic factor is needed for red blood cell production. So you know that your red blood cells come from the stem cells in the bone marrow, right? The stem cell will become red blood cell. But for that to happen, you need intrinsic factor. Okay? Orange juice helps with the absorption of that intrinsic factor. But what was I going to say? Oh, so everything that we're going to talk about here, you can replace it synthetically except for intrinsic factor. The technology is not that far advanced to allow us to find something that can contain intrinsic factor. It's very, very labile. So that's why people who have stomach pathology will develop anemia very easily. Like people who have ulcers, okay? Peptic ulcer. Okay, next, there's another columnar cell, and its job is to make pepsinogen. That's where the word pepsin comes from. I want you to know the word zymogen. So remember, I told you about the 3 enzymes, amylase, lipase, and I said there are several proteases, right? Proteases are the enzymes that will digest the proteins. Every single protease that we will be covering, they are always made in zymogen or inactive form. So this parietal cell makes pepsinogen. This chief cell makes pepsinogen. It's the inactive form. Because if it made the active pepsin, that pepsin is going to end up digesting the proteins of the cell. So it's important for the cells that make proteases, it's important for them to make it in inactive form. When they land in the lumen, that's when they become active because they want to digest the protein in your food, not the protein of your cells. Does that make sense? So the chief cells make pepsinogen, the inactive form. Enzymes are proteins. So for pepsinogen, what activates it is the acid, right? You have hydrochloric acid here. It's perfect. The acid will denature the pepsinogen to convert it to pepsin. So you can start digesting the protein that you ate, part of the bolus. So the acid will denature the pepsinogen as well as denature the protein in your food to help with the action of active pepsin. Beware, in the test, know that pepsinogen is inactive. When we're talking about protein digestion, you should see the word pepsin. Pepsinogen does not digest proteins. Pepsin does.
Say that again.
Pepsinogen will not digest your proteins. What will digest is pepsin. You have to convert it to pepsin first.
And what's the zymogen again?
Zymogen is all of the inactive protein enzymes. One zymogen we are learning right now is pepsinogen. Inactive protease is zymogen. Okay? Question on pepsinogen and pepsin. Question? Okay? Okay. Then we also have an enteroendocrine cell. Remember, enteroendocrine cell are cells that make hormones. Here, it's called G cell. What does the G cell make? It makes the hormone gastrin. It's an autocrine hormone because the target is the stomach itself. It tells the stomach to increase activity. What do we mean by increase activity? Two things. Increase muscle contraction and increase secretion of the cells of the mucosa. The cells of the mucosa, the collective secretion is called gastric juice. Okay? Don't worry about the D cells, just G cell, just one. The stomach has a third layer, an innermost oblique layer of smooth muscle. So remember, the smooth muscle is circular, inner circular, outer longitudinal. It has an innermost oblique layer. It has 3 muscle layers for powerful churning. Okay? This morning, they did their dissection and they tried to push open this sphincter. There's the lower esophageal sphincter. And then this one right here, this is called the pyloric sphincter. There are 3 parts to the stomach. There's the fundus, the bulge right there. That's where the fat usually lands. And that's why when you eat at the buffet, you feel like you're like up to the neck because the fat sort of resists any more that comes down. Okay? Anyway, that's the fundus, there's the body, and there's the pylorus. Of all of the sphincters in the GI tract, the pylorus is the one that is the tightest. Okay? It's very tight. When we say it opens up, you would think it opens up like that, right? But it doesn't. It just opens up a little bit. So what's going on with this, if the bolus is still in solid consistency, it's not going to be able to make it through. So they just keep being churned again and again and again, being acted on by the gastric juice until the bolus becomes liquid in consistency, which is called chyme. So in chyme consistency, that is going to be able to pass through the sphincter to make it to the duodenum, which is the first part of the small intestines. And that's why we have that third muscle layer. You're just like Baba, who eats in 2 seconds, he's done. It's like, if you're still eating, what's his comment? What he used to say something that just annoys me and Lily. Okay? So that's the function of the stomach. It's like your internal teeth churning, converting it to chyme. So let's look at the composition of chyme. that's being squirted to the duodenum. Right? What's the composition of chyme? First, we know that the chyme is acidic in pH, right? Which is low. It has low pH. It is liquidy. I know that chyme will have some glucose monomers plus some dimers, maybe. Are you familiar with maltose, sucrose, lactose? Right? Those are dimers. But then there will still be some intact polysaccharides or carbs. And then also the chyme will now contain some amino acids and some dipeptides, but still lots of intact polysaccharides. Okay? Or proteins, intact not polysaccharides, polypeptides, still intact. That chyme will also contain untouched lipids. So this is the composition of chyme. Acid pH. That's going to land in the small intestine, the first part of which is the duodenum, right here. Okay? Question so far? Question?
Do we need the detail?
No.
Okay.
I just asked.
I was
the
gonna
G.
say, yeah, I didn't highlight it. Okay.
So, you see, it's amazing, right? They have a job to do, and once the bolus lands here, the G cell just wakes up the rest of the stomach to increase activity. And again, when we say increase activity, two things. It means increase muscle contraction and increase secretion to start processing the food from the buffet. Okay? I wonder if I'll get in trouble if I say, let's all go to the buffet.
Let's go.
You gonna pay
I
for
can
it?
eat. Let's do it.
Baba will pay for it.
Oh, okay. Aw. So nice.
Okay, so here's the histology of the stomach. I will talk about the histology downstairs in the lab for you in the afternoon lab. We did this morning already. But the one thing you'll notice as far as the stomach is concerned, in the submucosa, there's a lot of this cuboidal epithelium. They're actually glands. They're called submucosa glands. They make more mucus to coat the lumen of the apical surfaces of your stomach, thick mucus to protect it from the acid gastric juice. So now you know why there are some drugs that are not given orally. They can only be given parenterally or IV or injection. Okay? You know the answer if I ask you that in the test or the lab exam. Okay? Okay. Next, this slide just shows you collectively what does the summary of the events going on in the stomach. You see the gastrin, you see the nervous system. By the way, what is this for the stomach? Is it sympathetic or parasympathetic for the entire GI tract?
Parasympathetic.
Parasympathetic, right? That's your rest and digest. The parasympathetic stimulates the activity of your entire GI tract. Sympathetic will slow it down. Okay? Next, let's go down. See, now it's liquid and acidic. Know the composition always. There's glucose, there's amino acids, plus intact carbs, intact proteins, and untouched fat. Okay. It's gonna land here, liquid chyme. The chyme actually drips, is just a little bit at a time because we want to be very efficient in digestion and absorption. You know that the small intestine is the last stop. After that, you're going to poop, right? The colon contains poop. Okay, so the duodenum, what did we say? We said that the entire GI tract the pH is alkaline. Only the stomach is acid, which means this is in danger. Of all the parts of the small intestine, there are three parts, right? The duodenum, the jejunum, and the ileum. Hold on. There's the duodenum, there's the jejunum, and then there's the ileum. Of the three parts of the small intestine, the one that's most prone to acid damage is the duodenum. Okay? This first part. So, it's also made up of cells. Of course, also columnar cells. This slide is first showing you, it's trying to solve the problem. One thing you should know about the small intestines is it really does not secrete the amylase, lipase, all of those proteases, all of those very important enzymes come from the pancreas. Okay? However, the duodenum secretes, especially the duodenum, okay? Because when you get to the jejunum, you're just going to absorb. So the duodenum secretes what you call brush border enzymes. The reason it's called brush border is because the border, the apical surface, looks like the bristles of a brush. It's the fuzziness. That's the microvillus, right? So they call it brush border enzymes. So they do make a few enzymes. And the name of the enzyme is, I know you know what it will digest. The name is lactase, sucrase, sucrase. What's the other one? Maltase. So these are enzymes that digest the dimers of the carbs, right? This one will digest lactose in milk. This one will digest the sugar, sucrose. And this one will digest the maltose. This will digest dimers. But the big polysaccharides, you need amylase for that. So if you give the duodenum this one, you're good. But if the duodenum still receives the long chain, you're not good. That's why you need amylase still. Where does the amylase come from? Pancreas. Okay? There's another enzyme that there's several others, but another one that I want to add, two more. Another one for protein digestion. It's called dipeptidase. Same thing. This one will digest the proteins, right? But so proteins are long chain amino acids, right? If you're just down to the last two, you just need to break the last bond. That's what the duodenum can do. But if you give the duodenum long chain proteins, trouble. What will help you digest the long chain proteins are zymogens coming from the pancreas. Okay? So the pancreas has several zymogens. What's a zymogen again? Inactive protein digesting enzyme. We're going to look at those zymogens. There's one last enzyme that the duodenum makes. There's several. I'm just picking on what I like. Not what I like, but what I feel is important. This one is called enterokinase. Enterokinase. This is the key to activating the zymogens from the pancreas. You need to take note of that. Because you see, in the duodenum, it's not acid that will activate the zymogen. in the stomach, we said the hydrochloric acid will convert the pepsinogen to pepsin. But in the duodenum, it's going to receive the zymogens from the pancreas. But this is not acidic, it's basic. What will activate the zymogens here? What will start their activation is that enterokinase. Which one needed acid to activate the zymogen? Yeah, which is where? Stomach. How about here? Is acid going to activate the zymogens?
No.
No. What will start the activation? Which is
Enterokinase.
another enzyme, right?
You said those all come from the duodenum.
Yeah.
Okay.
They're from the secretory cells, the columnar cells of the duodenum. Okay? So, looking at the enzymes produced by the duodenum, big trouble, right? It needs help. The help will come from the pancreas and the gallbladder, because we said that it's receiving still some intact carbs and intact proteins and untouched fat. The fat is a big problem. You need to hurry up and digest that fat. You have to begin and end here. So this one, the enteroendocrine cells of the duodenum, has to call on this by the release of hormones. That's why you need to know these two hormones, cholecystokinin and secretin. These are hormones made by the enteroendocrine cells of the duodenum. So the target of cholecystokinin, or CCK, is mainly the gallbladder. It tells the gallbladder to squirt bile into the duodenum. So you trace this, you see there's the bile duct right here. It's going to squirt bile here. Okay? And then the target of your secretin is the pancreas. It tells the pancreas to squirt pancreatic juice right here. So it has everything. One more time, the duodenum we know is simple columnar epithelium. Some of the columnar cells here, what do? This is what they do. They keep making all of these enzymes, right? We know the function of these. We discussed that. And then some of the cells here, what do? They make these hormones. That's why they're called enteroendocrine cells. You should know the target of each hormone. Okay? That's how the bile ends up in your duodenum, as well as the secretions from the pancreas. Okay? I was just going to say something. I forgot. Oh, yes. Okay. So, do you tell me if you're confused? Another effect of these two hormones, what do you think? They also target the stomach. But can you guess? What will these hormones tell the stomach? Will they tell the stomach to quickly and actively keep dumping chyme here, or will they tell the stomach to slow down? Very good. Do you agree? We have to tell the stomach, can you slow down? I just received all of this. I need to efficiently digest. So slow down, right? And then once they're finished, this one, the level of this one goes down, then more squirting, and then go up. Negative feedback. Very good. Okay? We're going to talk about now the digestion. So here's your pancreas. This is from secretin, right? It's telling the pancreas to secrete. Remember the pancreas, we discussed this when we talked about our endocrine system. That's why the pancreas is called a mixed gland. It has both endocrine and exocrine secretions. The exocrine secretion is what we're covering. It's the pancreatic acini. The endocrine part is your islets of Langerhans. Okay? So here, there's the acini or the acinus. That's the exocrine part. The endocrine part is the islets. Their secretion collectively is called pancreatic juice. Where do they end up? They end up in the duodenum, right here. Look at the contents of pancreatic juice. First, you can see that it has bicarb. Very important, right? To buffer the acid from the stomach. And then next, look at all of these enzymes. Look at, it has pancreatic amylase. What will this digest? Amylase? Carbohydrates. What will this digest? Pancreatic lipase? The fats. And then, do you see these proteolytic enzymes? There's the parenthesis. It says trypsin is secreted as trypsinogen, which means this is the secretion from the pancreas. Same with this one and this one and this one. These are called this, right? They are in zymogen form. And I want to tell you that the enterokinase from the duodenum is the one that will convert this one to this. And then this one is the one that will activate the rest of the zymogens. Okay, one more time. The pancreas secretes all of these zymogens. The enterokinase from the duodenum will convert trypsinogen to trypsin. And trypsin is the one that will convert or activate all of the rest of the zymogens. So now you have active proteases that will work on the food that's here, not on the protein of the cells.
You said the enterokinase changes trypsinogen to trypsin?
Yes,
Okay.
and then trypsin will be the one that wakes up the rest or activates the rest. And now you're ready to digest everything, right? But let's look at fat digestion. Fat digestion is a little bit unique because fat settles, right? It separates from water. So if you imagine, right here, the fat is one big glob. Enzymes can only act on the surface. So if you're one big glob, if you're one big fat glob like this, what do you think will be faster to digest? A big fat glob like that or these smaller globs?
Smaller.
Yes, and that's exactly what bile does. So mixing of the bile with the pancreatic juice right here, the bile what emulsifies the fat. When we say emulsify, it means make it into smaller globs so that it's easier for the lipase to work on it. Right? Because you're under time pressure, the bus keeps moving. What do we call the forward movement of the bus here? Peristalsis. It keeps moving. Plus, now you know, that's why in the small intestine, you have to lock them for Match.com. Segmentation. You have to lock them in segments to be very efficient in digestion. Okay? Now, do you know of someone who has no more gallbladder, is still alive? Okay, yeah, right? My mother, before she died, she had no more gallbladder, right?
Yeah,
But what is, because the bile from the gallbladder actually comes from the liver. The liver makes the bile. The gallbladder just stores and concentrates that bile. So what is the benefit of having a gallbladder? It's called on demand. When you eat a lot of fat, a lot of bile is squirted. When you don't eat that much fat, not too much bile is squirted. But if you lose the gallbladder, look. Simon, look. You see right there, you see the bile is from the liver, right? See green, then just store it there. On demand, green, see, take this out, the green originates right here from the liver. So if you have normal gallbladder, the problem is no more on demand. So it just trickles the same amount of bile all the time. What happens to those who have no gallbladder? Go to the super buffet. Count the number of times they go to the bathroom. Explosive diarrhea because the fat is not absorbed. So fat exerts an osmotic gradient, right? And so they're not being digested, and so they have to go to the bathroom more. So that's why, in comparison, they are usually thinner than their, healthy counterparts. Okay? But can you live without a gallbladder? Yes. Because the bile comes from the liver. Okay? So actually, the secretion from the pancreas begins. It's related to your parasympathetic nervous system. Remember, that's your rest and digest. And then the stomach creates what you call a reflex, where the activity of the duodenum starts increasing. But remember, secretin is the main hormone that tells the pancreas to secrete its pancreatic juice to the duodenum. Okay? Okay, next is the liver. So we said, okay, function of the pancreas, secrete pancreatic juice. Function of the gallbladder, make bile. And we said that the bile comes from the liver. So we have to talk about the liver. Today, after class, can you stop by Office Depot, buy yourselves a diary? Dear, that will be too many dears. Dear liver. And then the back portion of the diary, we're going to start with dear kidney. But now, dear liver. Okay? You say, I appreciate you. Happy Valentine's. Look at what the liver does. Okay? Here. So, again, look, Simon. Here. Remember, we said, and we discussed this morning, let's just review for a minute our cardiovascular system, right? We said that the heart, the left side, the aorta, is delivering oxygenated blood, right? Aorta, then you remember your superior mesenteric artery. The superior mesenteric artery goes to the small intestines, where it breaks into capillaries, okay? So it's delivering oxygen to the cells of the small intestine. Now you know why they need oxygen. They're very busy, right? They're trying to digest and absorb. They're calling on the pancreas, everything. So they need that. And so then by the time they leave, this is your veins, right? They're blue because they're now deoxygenated. But these veins, they're nutrient rich because they absorb the nutrients from the small intestines. So this will collect here, and this is called portal vein. The reason why it's called portal vein is because it doesn't go enter or join the inferior vena cava right away. It makes a stop at the liver. And in the liver, it breaks into another set of capillaries. The capillaries in the liver is called a sinuses. Right? You have fenestrated capillaries, you have discontinuous capillaries, and then you have sinuses. Okay? And this is how the liver looks like. There's your portal vein right here. Imagine the portal vein. This is the portal vein. When it enters the liver, it looks like this. There's the portal vein. And it's going to break into capillaries. These capillaries are called sinuses. So the sinuses are flanked or bordered by the hepatocytes. These are your liver cells. Okay? We learned in Bio 241 that one of the functions of the liver is to store glycogen. Remember, this is oxygen poor but nutrient rich. You just finished digesting, right? You just absorbed it. So there's lots of nutrients. Amino acids, glucose, and your free fatty acids, they have been absorbed. So this is nutrient rich, oxygen poor. What will these hepatocytes do? They will keep grabbing glucose so they can pack themselves with glycogen, so that you can have something to withdraw in between meals. That's what they do, right? What else do they do? All of the amino acids that pass through, not all, the amino acids that pass through, they will be using, those are the ingredients that they will use to make your proteins in the blood, like albumin, globulin, etc. Right? Your complement proteins, your whatever proteins in the blood, it's made by the liver for you. How did they do that? You had to provide the amino acids from your diet. And then very important, the fat. The fat will be processed by the liver. We're going to talk more about fat metabolism in the next chapter. The liver does that. Their smooth endoplasmic reticulum will process the fat. Okay? What else do they do? We said that the liver is the one that makes bile. So look at the direction of the blood through the portal vein. This is going to go up. Central vein, from portal to the capillaries, the sinusoids, and then central vein. And this will eventually join the inferior vena cava going up. But the liver, the hepatocytes, will also be grabbing cholesterol and use that cholesterol to make bile. Bile is made up of cholesterol and bile salts. So what's the direction? It's opposite. The bile is going to go down because that's where your gallbladder is. Goes down right here. So the portal system, the blood goes up, but this one, the bile, goes down to store in the gallbladder. That's the main job of the liver. Did you get that? Simon was like, yes. Look. Everyone else besides Simon, did you get that?
Yes.
Okay, good. Guess what? Everything else that you see here, look. So, remember, we just talked about the main job of the liver. The liver is one of the workhorses. This is what now makes it clear, hopefully. That's why the liver, when we talk about metastasis of cancer, or when we talk about any effect of anything, you always have to consider the liver, right? Anything that's absorbed makes a stop at the liver. So that's why when we have prescription medication can be harmful. What does the liver do? Detox. Convert it to less harmful. And this, if you have good doctors, they don't just blindly refill your prescription. They always say, please come in, I want to check your liver. I want to make sure your liver is still okay, right? Because what is this? That's overtime job for the liver. You see? What else is detoxifying? Look. Alcohol. Right? It's going to convert it to less harmful. That sign, alcohol limit, 0.06, is not the favorite number of the governor or the president. That one right there is posted thinking about the physiology of a healthy adult, not teenager. Right? You heard the people who die from alcohol poisoning. And we're going to talk about that in the next chapter. It's deadly. Okay? What else are they going to detoxify? Anything that we inhale. From cigarette smoke or from anything, you inhale, it's in the blood. That's what it will do. So, if you look at this one, see, there are phagocytes. It's cute. They're called Kupffer cells, or phagocytes, right? Kupffer cells. I think it's double F or one F, I forgot now.
It says Kupffer.
Oh, double F. Kupffer cells. They're phagocytes. They help in case there's germs that entered. They help prevent it. Because look, where is it going to go? It's going to eventually join the rest of the circulation. So what is this blood right here that enters the inferior vena cava? It's oxygen poor but nutrient rich. Then it's going to go to the lungs to become oxygen rich, nutrient rich. Then the liver, and then make the same thing again and again and again. That's the story. Okay? So, do you agree? The liver is always the first one to suffer. Do you agree? That's why people with liver failure are in danger. What can they suffer from? Diabetes. Right? Because that's what the liver does. It stores glucose. If it's damaged, how can it do that? You're going to end up with diabetes. Right? And so many other things. That's what the liver does. God loves us so much, we have several lobes of the liver. Right? So, there's several, you saw the cat, several lobes. Maybe one lobe can be damaged, you still have a healthy other lobes. But don't take it for granted. Because those chemicals, like, do you remember how it cooked the lungs? Don't think that it cannot do the same. Right? Okay? And this is why it's always, sometimes you like go crazy. They say, okay, nitrates are harmful, this is harmful, this is harmful. I'm just not going to cook myself, pick from my chair, whatever, right? But they're thinking about that. Okay? So pay attention when they say alcohol speed limit, maybe, not alcohol limit, there's a reason for that. We have to adjust that. If you're taking prescription medication, you have to adjust that. Because that alcohol is overtime job for the liver. Okay? Overtime. So if you're, look, there's another one right here. Right? It's the one, the liver is the one that will use the cholesterol to make your sex hormones. Your estrogen, progesterone, everything. Whatever you need, the liver will give that for you. It will pass through, then the liver will make that for you. Like Baba says, what you want? Then tomorrow I have it. In my dreams. Okay? Okay? So, in your, the microscope downstairs, identify, we're going to talk about that in the afternoon lab. Any question on the liver and the pancreas? Question? Okay, let's take a break. People are walking up. Maybe you need to go to the banyo. Make a quick 1 minute.